Welcome to the University of Michigan School of Nursing 2024 Commencement. My name is Ruth Zielinski, and I am a clinical professor and the Midwifery Graduate Program Lead at the School of Nursing. It is my privilege to be serving as the MC of today's event. To begin our program, I would like to introduce the Dean of the University of Michigan School of Nursing, Dr. Patricia Hearn.
Thank you, Dr. Zielinski. Good afternoon, students, families, friends, colleagues, and the graduating class of 2024. I'd also like to recognize that for many of you, this is a very special graduation. 4 years ago, this wouldn't have been possible, and so we're extra celebratory today, because this is truly your day, a day in which we're about to begin a ceremony that recognizes each of you for your hard work and your accomplishments. All of you have earned the place where you stand today as a Michigan nurse. I have learned over my time as your dean that Michigan nurses are known and respected everywhere. With this commencement, you will become part of a really great heritage. You are graduating from a 133-year-old nursing school, which is part of a fabulous and great university. You are part of a graduating class of 310, and you will now join over 13,000 University of Michigan nurses, our alumni. As students, you have joined your faculty and our many clinical partners to change lives and save lives every day. Each challenge to your goals, each moment of uncertainty, each test tells a tale of your character, your intelligence, and most of all, your compassion. You have learned, and you are ready. The theme of our ceremony today is all about transformation of health and healthcare. It is true that the United States is the #1 spender on healthcare in the world. Yet we continue to rank at the bottom in health outcomes as compared to other rich countries. Now, it is nursing's job to lead a solution to this, to reinvent healthcare so that it provides health for everyone. Our speakers today will give us a glimpse into this issue and how nursing is truly poised to lead a change. Our two speakers are cancer healers, cancer scholars, and we're using cancer as an example to make the point of what needs to be transformed. Please know that each of you will always be part of this school. You will dare to be great. You will seek to advance the public good, and you will always, always provide health to all. I want to thank all of our communities who will play key roles in this celebration, and a special thanks to our student speakers who have practiced hard to share their thoughts with you. Graduates, through hours of work under extraordinary circumstances, you have earned a degree that signifies to your colleagues, to your patients, and to the public that you are the most highly accomplished nursing clinicians and scholars in the world. Welcome to all, and let's begin. So each year, students and faculty put forth nominations for the Teacher of the Year award in our school, and this is a very, very important effort. This award is for excellence in teaching, and it's given in the memory of May Edna Doyle, a distinguished 1938 graduate of our school. Today, we honor this year's awardee, a teacher who has well prepared each of her students to be a Michigan nurse. After a thorough and thoughtful review by our selection committee of many, many impressive nominations, because we have a great many great teachers, they selected Clinical Assistant Professor Dr. Linda DiClemente. As you can see, she's well known. Dr. DiClemente is a dedicated teacher and an expert nursing clinician. In addition to her unwavering commitment to teaching and inspiring her students, hallmarks of her teaching include establishing a safe learning environment, a therapeutic sense of self, flexibility in teaching methods to suit student circumstances, and a student-centric vision. Dr. DiClemente is a leader in employing inclusive teaching techniques and strategies to promote inclusion in her courses and programs across the School of Nursing. It is with the deepest respect and admiration from grateful students and colleagues that we present this prestigious award to Dr. Linda DiClemente, the 2024 May Edna Doyle Teacher of the Year.
Class of 2024, it's time to hear from you. You have spent years working toward the degree that will be conferred upon you today. So much of that time was spent together with your fellow classmates. You not only learned together, you learned from each other. What you take away from those shared experiences differentiates the class of 2024 from the hundreds that have come before you. Now please help me in welcoming our first of two student speakers who have been chosen to speak on your behalf today. DNP student Dalton Noah Bender.
When I first applied to the Family Nurse Practitioner, Doctor of Nursing Practice program, it was weeks before the world was shut down due to COVID-19. I was hopeful for what the future held for me and the opportunities ahead. Little did I know that I would have to shave my beard for the next month and reuse N95s because none of us were prepared for what the next 3 years held. I also shaved my head, but that was unrelated. The pandemic was not easy for any of us. And the hardest thing that I've ever had to do as a nurse was listen to a man sing, "You Are My Sunshine," to his wife over an iPad through gasps for air just days before taking his last breath. With that said, being a nurse is not hard. I would choose it time and time again because I was meant to do this. I was meant to care for people. All of us in this room, we have patients, we have family, we have people that we carry with us throughout our lives. But nurses, we do this every day, and this is what makes us some of the strongest people you'll ever meet. Nurses continue to be the most trusted healthcare professionals year after year. We are the most visible frontline staff in all settings, including hospitals when people are most vulnerable. Most patients' needs can generally be addressed by the nurse, yet most of the nurses in this room have had the experience of answering a patient or family member's question only to be told, "No, I want to hear it from the doctor." In these situations, often an hour later, a provider, usually an advanced practice provider, comes in and tells the patient the same exact thing that you just told the patient. The point is that nurses are knowledgeable, experienced, dedicated, and present. Our visibility and considerable presence make us key individuals to impact healthcare for the better. This brings us to the theme for this year's commencement, Transformation in Healthcare. Thinking back to my application for admission to this program, I recall being asked to answer a question about the future of healthcare and transformation in healthcare for part of my personal statement. My response was, and still is, a quote that simply states, "The only constant in healthcare is change." It has been the driving factor for me as a Doctor of Nursing practice student because what I've learned throughout my more than a decade-long career in various fields of healthcare is that there is nobody better than a nurse to make change. The opportunities I have had at the University of Michigan School of Nursing have further influenced my desire to be a leader for change. UMSN students have the opportunity to learn from faculty who are passionate about education and will go above and beyond for their students. Faculty who have been extremely personable and made my experience as a student so much richer and more enjoyable because I've been treated as a colleague rather than a student. Some of the amazing opportunities that I've had as a student is that I've been fortunate enough to provide care for underserved and underrepresented populations where I found passion in helping those who need it most. I was also able to provide gender-affirming care and work with faculty to develop a program at the School of Nursing to educate future nurses and nurse providers about queer competent healthcare. My two key takeaways are that healthcare is a right for everyone. It shouldn't be only for the wealthy. The second is that it's never acceptable for a healthcare provider to cause harm or make a patient feel that they don't deserve time or competent care. This program has not only transitioned me from a nurse to a nurse practitioner, it has also prepared me to be a leader in nursing and further my advocacy for nursing and patients alike. As I grow in my career, I will continue fighting and advocating for nurses and patients. I know my colleagues who are here with me today share my desire to be a leader for change, and I'm confident that even if you don't feel ready, you are more prepared than you think you are to be successful providers and leaders. Our faculty and staff have invested in as much in us as we have invested into the cost to going to U of M, which, by the way, for everyone in the audience is a lot. Thank you to everyone. I feel honored to be able to represent an amazing class of future nurses, advanced practice nurses, nurse leaders, nurse innovators, and nurse researchers. Congratulations to the graduating class of 2024.
Thank you so much, Dalton. Now, please help me in welcoming BSN student Nina Juliet Hidalgo Guzman.
All right, welcome, ladies and gentlemen, esteemed guests, and welcome to our nursing graduates of 2024. Woo! My name is Nina Guzman, and I am receiving my Bachelor's of Science in Nursing. I want to take a moment first to thank my parents, my siblings, extended family, faculty, mentors, and my friends and boyfriend who have all shown me continuous love and support throughout my college experience. Now, the question that I have been asked the most in nursing school is, why would you come to endure Michigan weather if you're from California? After that, I'm asked, why nursing? I still can't answer the first question, but the second one is easy. Anyone that knows me has heard this story before. I did not intend to go to nursing school. The University of Michigan was the only school I applied to as a nursing major, and that was because of my mom, who has been a phenomenal nurse for 20 years. She encouraged me on my last college application to apply, and nursing really clicked for me during one of my freshman classes where my professor said that all policy is health policy. I had that little light bulb that you see in cartoons, and I absolutely fell in love. And that brings me to the theme of this ceremony, which is the coming transformation of healthcare. After that freshman class, I saw myself as a vessel for change and transformation, and I will explain how and why every single one of these graduates are as well. Now, when I look at the healthcare system, I see it like a tree. It's multifaceted, yet interconnected to support life and well-being. The roots are the anchors of the system and represent the foundation of health, including preventive efforts, public health, and education. The trunk is the backbone of the healthcare system, providing structure and support. These are the healthcare providers, the hospitals, and the clinics. Then we have the branches that represent the different specialties and areas that we see patients in. And finally, we have our leaves. Everything that tree is working for is to provide growth and well-being for the leaves, or our patients. And what's unique about nursing is that it is embedded in every facet of this tree analogy. We are in public health, influencing policy. We are the providers. We are present in every specialty. We are integral to the patient's care. And we utilize the outside environment to shape the way we think about and provide care. Every single part of that tree includes us. This is why we are the best vessels to implement change. But oftentimes, when we think of nursing, the initial reaction can be someone who is kind, caring, and empathetic. We picture someone holding your hand, consoling you, and sharing those hard and happy moments with you, which are all true. I can say firsthand that I have tried to be that nurse. From my very first clinical, where I cried with my patient over their cancer diagnosis, to my last inpatient clinical, shedding tears of joy over their beautiful birth. What we forget at times, though, is that nurses are innovators, advocates, and vessels for real, durable change. Here we are at a time in our lives when difficult conversations are being had, and we have a seat at the table. It's what we've been preparing for. Not only have we practiced clinical skills, but we have been learning to perfect our worldly skills of being advocates and policymakers for a variety of patients, communities, and population. Now, the coming transformation of healthcare not only includes policy change, but also an evolution of the way we view ourselves. Mental health has taken an increasingly large role in healthcare, and we are educated in giving weight to it, not just for our patients, but for ourselves. Taking care of ourselves, ensuring we are healthy in body, mind, and spirit is crucial to a more productive, safe, and successful healthcare environment. As new nurses, we will bring in the culture of self-care and preserve our boundaries when it comes to balancing our health and work needs. I want to leave you all with this. Nursing has the power to transform healthcare into a system of inclusivity with an emphasis on well-being and equitable care for all. As some of us start and others continue our nursing careers and education, I urge you to view yourself as an agent of change and an advocate for brighter, healthier futures for all of our patients and ourselves, in whichever field you may choose. Congratulations, class of the 2024. Best of luck on your journeys and your transformation of healthcare. Go Blue!
I'd like to introduce our first commencement speaker, Dr. Lori Pierce. Dr. Pierce is a professor of radiation oncology, School of Medicine, adjunct professor of Department of Systems Populations Leadership, School of Nursing, and vice provost for academic and faculty affairs at the University of Michigan. Dr. Pierce has dedicated her career to the treatment of breast cancer patients and is known nationally and internationally for her work. She leads national and institutional clinical trials in breast cancer, and her research focuses on combining radiosensitizing agents with radiation in the treatment of resistant breast cancers, developing biologic markers to predict radiation response, and developing advanced techniques of radiation delivery in the treatment of women with breast cancer. Her research is funded by the National Cancer Institute and the Breast Cancer Research Foundation. She serves as director of the Michigan Radiation Oncology Quality Consortium, a quality consortium of radiation oncology practices across the state of Michigan that seeks to establish best practices in the treatment of breast, lung, and prostate cancers. This initiative is funded by the Blue Cross Blue Shield of Michigan and Blue Care Network. She is a previous member of the NCI Breast Cancer Steering Committee and previously served on the steering committee for the Early Breast Cancer Trialists Collaborative Group at the University of Oxford. She is a member of the National Academy of Medicine. She continues to serve on many U.S. breast cancer boards and committees and is a member of the Breast Cancer Research Foundation Scientific Advisory Board and the board of the Damon Runyon Cancer Research Foundation. Please join me in welcoming Dr. Pierce.
Thank you, Dr. Zielinski. Class of 2024, what an honor it is to be with you today to celebrate all you have done to get to this special day. You have worked hard, you have sacrificed, you have tested the limits of your intellectual capacity and drive, and very likely the limits of sleep deprivation. I applaud you, knowing that you have navigated a journey that likely included bumps along the way, but you remained resilient. You should take pride in all you have done to get to this point. And here you are on this surreal day, your graduation from the University of Michigan School of Nursing. It is one of the triumphs you will remember for the rest of your lives. To the family members and friends who have supported you along the way, thank you for your sacrifices to help these graduates achieve their goals and dreams. And to the faculty, thank you for all you do every day to educate and support our students. Graduates, I know that commencement day can be a time of complex feelings. Pride, relief, joy, gratitude, and more than a little anxiety are commonly felt right about now. A few years ago, research was published that declared there are 27 distinct human emotions. Well, congratulations, graduates. You have chosen a profession. You'll get to feel all 27 in the course of your work and maybe even in the course of a day. Because at its most elemental, yours is a profession of being, as Teddy Roosevelt said, in the arena. Your role is not that of commentator, though you should never be afraid to speak your mind. Your role is not that of spectator, though you will see more than most. Your role is down in it, in the midst of humanity, among people desperate for care, seeking certainty about their future health, eager for understanding, sometimes frustrated, angry, grateful, grieving, and cautiously full of hope. In some respects, the graduation day is a microcosm of that great adventure to come. Many of you are here with people who care for you deeply, and you know how much that means. And now here you are, grateful for your family and friends, grateful to realize that you had what it takes all along to get here. And you are cautiously full of hope for a bright future in one of the world's greatest professions. And as you face the career and practice challenges to come, the hope you feel today, born of an earned faith in yourself and the depth of your education, will continue to light your path. Those of us in the health profession need your conviction. We need your compassion and the pursuit of excellence every day to help us all be better for patients, families, and communities. We need that from you, your conviction and your drive, because the U.S. healthcare ecosystem has a lot of work to do. Here are some healthcare system performance rankings comparing the U.S. to 10 other high-end countries taken from the Commonwealth Fund Foundation that was collected just prior to the pandemic. Among the 11 high-income countries included in the analysis, the U.S. ranked 11th in access to care, administrative efficiency, equity, and healthcare outcomes. The U.S. ranks second in care processes, which included preventive care, coordinated care, patient preferences, and engagement, but the overall ranking for the U.S. was last at 11. An updated Commonwealth Fund analysis included data from 38 high-income countries and found that the U.S. is the only high-income country that does not guarantee health coverage, has an average life expectancy 3 years less than the 38-country average, has more avoidable deaths, and the highest rate of infant and maternal mortality. And that adults in the U.S. have an obesity rate nearly double the rate of the 38-country average. And not surprisingly, the U.S. adults are more likely to have multiple chronic conditions. So these numbers are, of course, just a snapshot of healthcare in the U.S., but the picture is clear. Healthcare must be transformed. So how do we reimagine healthcare? Well, not just one profession can affect all the changes we need at the local, state, and national levels. All of us in healthcare need to work together. We must effectively communicate with each other, respecting each other's particular contributions to the care of our patients and our communities. We can do that better by reimagining ourselves together as equal participants. We need to take the best from all of us to get the best from all of us. As you heard, I'm a radiation oncologist. I'm a cancer doctor and researcher, and I focus on breast cancer. I think of cancer morning, noon, and night. And while I know that probably doesn't make it sound like I'd be particularly fun at parties, I know that, I do think about cancer all the time, in part because cancer is an object lesson. Dr. Siddhartha Mukherjee called cancer the emperor of all maladies in his book by the same title. In the way it looms large in our lives and our fears, cancer is kind of a stand-in for the way we grapple with illness in general. So when I think of cancer, what I'm really thinking is, what could we do overall to be better? And when I say we, do I mean patient caretakers, or as healthcare establishment, or society as a whole? Well, the answer is yes to all of the above. That's why I, as a cancer doctor, am just incredibly humbled to have the opportunity to speak to you today as the future of nursing. Because I believe a revolution is necessary in the way all of us in healthcare collaborate and relate to one another, a regrounding in the central purpose of why we are doing what we do. I believe we can see this when we examine cancer as an example of how we can and must be better together. So with respect to cancer, I am gratified to see the rates of cancer deaths have decreased since the early 1990s. Clearly, increased rates of screening and improvements in treatment are decreasing the rates of cancer deaths. But there's so much more work to be done, and much of it is systemic. For some types of cancer, the rates of cancer death have not gone down, they've been the same, and some have actually increased. And while rates of smoking have decreased, and smoking is associated with 16 types of cancer, other factors such as obesity have increased. And obesity alone is linked to 13 types of cancers. These cancers are largely preventable. The U.S. population is aging, and cancer rates increase with age, so cancer incidences in this country are increasing. And marginalized peoples in the U.S. and around the world, those marginalized based on race, ethnicity, gender identity, those residing in rural communities, those who are elderly, those with disabilities, and others, they have poorer outcomes with cancer and with other diseases. So with that as a backdrop, I wondered, what could I do to contribute to a meaningful change in cancer care? Then one day in 2018, I was nominated to be president of the professional cancer society called the American Society of Clinical Oncology. We call it ASCO, which is the largest society of cancer professionals in the world. ASCO is composed of about 50,000 physicians, nurses, pharmacists, researchers, administrators, members of the pharmaceutical industry, social worker trainees, all types of professionals who touch the lives of patients with cancer are members of ASCO. I had no plans to be president of ASCO. I was honored to be nominated, but I was anxious. Actually, it was more like a panic. But then I relaxed, took a deep breath, told myself, don't worry, there's no way you'll win the election. I won the election. Right? So then the anxiety really kicked in. How could I lead this powerful organization? How could I represent cancer patients who could not represent themselves in a healthcare system where so many felt unwanted and disregarded? My job would become not just fighting cancer, but taking on economic and social injustice. All this is to say, even when you become a professional, a successful professional, perhaps move into a leadership role and develop a sophisticated way of caring for your patients, part of you might be uncertain, and you might be scared, not of doing something new, but of the potential for failure. That's when I hearken back to lessons I learned from my parents. I went back to basic principles. Distill complicated scenarios into manageable steps and decide what your North Star will be that will guide your thoughts and actions. My first manageable step was to focus on the here and now, to take each day with its own challenges, no more, no less. Conquer the now, and in doing so, you'll prove you're equal to conquering the future. My North Star was simple. Every cancer patient deserves high-quality, equitable cancer care every day. During my year as ASCO president, which was during the pandemic, we put into place telehealth programs to help oncology providers navigate cancer treatment safely in the presence of COVID. We highlighted models of taking care to the patient rather than forcing the patient to come to providers. We put into place steps for clinical trial accrual in rural geographic settings. We started a program aimed to increase the numbers of diverse providers. And we emphasized collaboration among all disciplines and professions to unify the cancer workforce. So you'll notice my emphasis on we. I have worked alongside exceptional nurses and nurse practitioners throughout my entire medical career. Practically speaking, my nursing colleagues spend more time with patients than almost any other member of the team, and as such, patients often feel more comfortable and confide in nurses their deepest concerns and fears. Nursing professionals are critical to implementing planned treatment and care, instilling cautious hope and a sense of comfort. You are instrumental in patient education and advocacy, educating patients about their diseases, treatment options, self-care. And you provide critical information regarding prevention, advocating for lifestyle changes, which can make a significant difference in how patients tolerate cancer therapies, and in reducing the risk of recurrence and reducing the risk of new cancers. You are essential for symptom management and personalized care to manage treatment side effects. Nurses provide emotional supportive care to patients and their families, often when they are at their most vulnerable. Nurses provide palliative care, focusing on improving the quality of life for patients with advanced cancer, and end-of-life support to patients and their families, ensuring comfort, dignity, and respect. Nurses assist in the recruitment and retention of patients into clinical trials to advance research of all kinds and access to innovative treatments. Nursing is a crucial part of combating that emperor of all maladies. Those trained in nursing fields also advocate effectively for policies that improve access to cancer screening, treatment, and supportive care services. And by doing so, you address healthcare disparities and promote health equity for all patients, translatable across clinical diagnoses and multidisciplinary care. We need collaboration and teamwork within healthcare, and we need to create bridges beyond healthcare for the sake of our patients and their families. Every member of the care team for cancer or for any other disease, every member is important, but nurses often provide the foundation, that special sauce. In other words, you are often the anchor that supports successful initiatives in healthcare. Healthcare in this country and the world, we need you. Let your passions guide you. For me, that's fighting cancer. Each of you will find your niche and develop your expertise. You will find your passion as you go forward from this special graduation day. One day, you may find yourself on the threshold of uncertainty and feel that familiar cocktail of emotions, the promise and the fear in equal measure. I will tell you that never fully subsides. But when you do, hearken back to the lessons you learned here in your studies at the School of Nursing, engaging with the faculty and others at Michigan. The School of Nursing's ethos is one of daring. It acknowledges the risk of this profession, a profession that asks so much. The risk of days where being immersed in humanity has you feeling everything at once, and the chance to be part of a necessary and noble tradition that precedes recorded history, that is, of being a healer. Going forward, there will be so much for you to learn and experience. But what you have already accomplished in the past 4 years tells me you accepted the School of Nursing's dare. You dare to transform. You dare to advocate and create change that leads to meaningful difference. You dare to create a legacy. I am so excited for what each of you will accomplish. This is your journey. Enjoy every moment of it. I will tell you that improving the lives of others will give you a rush unlike any other. And wherever you go, whatever you do, go blue.
Next, I'd like to introduce our second commencement speaker, Dr. Ellen Lavoie Smith. Dr. Smith is a professor, assistant dean for research and scholarship, and the Marie O'Corin Endowed Chair and co-director of the Cancer Prevention and Control T32 training program at the University of Alabama at Birmingham School of Nursing. Her research is well recognized as pioneering and pivotal in identifying treatments for chemotherapy-induced peripheral neuropathy, also known as CIPN, a life-altering complication for which no known preventative treatments have been discovered. She received research funding from the National Institutes of Health, National Cancer Institute, resulting in the discovery of the first and only known treatment for painful CIPN to date, which is now recommended by the American Society of Clinical Oncology. She leads a large National Cancer Institute-funded multi-site phase 2 and 3 trial to test duloxetine to prevent CIPN. Dr. Smith lectures nationally and internationally regarding cancer symptoms management, leads multinational groups of like-minded scientists, and has published over 100 peer-reviewed manuscripts. As recognition for her pioneering work, Dr. Smith has received numerous national awards. Please join me in welcoming Dr. Smith.
Thank you, Dr. Zielinski, for that very nice introduction. And I'd like to thank Dean Hearn for inviting me to join in this beautiful commencement celebration today. And of course, I'm going to start off by congratulating all of our graduates, our faculty, the family and friends that are here to celebrate today. I love graduations. You know, some people think they're boring, but I think they're exciting and they give me a lot of hope and optimism for the future. So I'm going to pick up the torch passed on by Dr. Pierce, and I'm going to talk about cancer and health inequity very broadly. I'll start with a definition of health inequity. Health inequity occurs when people who hold unequal positions in society, such as minority populations or the poor, have less access to resources than other people. Your position in society is based on your race and ethnicity, occupation, educational achievements, and income. And you might be surprised that in the United States, 60 to 80% of our health outcomes, like being diagnosed with cancer, will be influenced by our positions in society. I'll talk more about that in a minute, but before I continue, I need to make a disclaimer. I'm not an expert in health inequity, nor have I personally experienced it. I've been a cancer nurse for 42 years and a cancer symptom scientist for nearly 20. And even with all those years of experience, I really considered health inequity in my work because I really didn't see it, because I really didn't understand it. I found an opportunity to expand my experiences through my current position at the University of Alabama at Birmingham, and that's not the Crimson Tide, Alabama. And you need to know that I proudly hung my Michigan flag on my porch during the Rose Bowl, so I'm a Wolverine. Anyway, since moving to the Deep South, I've become more aware of health inequality because now I see it every day. And so today, I'll share with you some of the things that I've learned, because I bet that many of you are like I was, just really unaware of the factors that cause health inequity. And so I'm going to start by sharing 2 examples of how racism and income lead to health inequity. And the first will be an example from history, and the second will be more contemporary. Let's start with Birmingham, Alabama. From the 1880s to the 1970s, Birmingham's Sloss Furnace Company was a major producer of iron and steel, particularly during World War II. At the top of the company was the all-white group of managers, chemists, and engineers, and at the bottom were the black laborers, who made a very low wage and included black prisoners who were forced to work for free. And this was after slavery had been abolished. It's also important to know that the Sloss factory was located in downtown Birmingham, and it created a lot of pollution that really blanketed the entire city. So now I want to draw your attention to all the people up in the balcony. I would like you to imagine that you are the educated, white, and wealthy executives who work at Sloss. You live in a beautiful mansion on Red Mountain that overlooks the polluted city. And because you live high above the pollution, you are at less risk of developing cancer due to exposure to Sloss's environmental pollutants. And so the rest of us down here on the floor, we are living in the Birmingham downtown area, and we are the black workers. We have to live in the polluted city because we are poor and because we are black. So turn around and look at the people on Red Mountain. How does it feel to know that all of you who are now down here in the polluted city have an increased risk of developing cancer when compared to the people in the balcony? This is an example of health inequity. Now I'd like to give you a more contemporary and local example. There are actually 7 hotspots in Michigan that have had high levels of environmental pollutants. And according to the Environmental Protection Agency, the residents in some of these areas have 8.5 to 11 times a higher risk of developing cancer over their lifetimes when compared to people who live elsewhere in the state. We know that housing costs in polluted industrial areas are generally lower, and so if you have a low income and you can't afford to move out of the pollution, your cancer risk may be higher due to no fault of your own. This is another example of health inequity. And where you live can increase your cancer risk for other reasons beyond environmental pollutants. Disadvantaged people who live in unsafe and deprived areas because they're uneducated and poor and consequently can't afford to live anywhere else, experience more social isolation, anxiety, and depression than those people who live in better neighborhoods. It's more difficult to go to church or to visit family or friends, perhaps due to a lack of transportation or money, or it's just not safe to go outside. And so this makes people feel stressed, and chronic stress is linked to cancer. We can determine if an area is deprived based on the overall income, education, employment, and housing quality within a census block. Researchers use a special scoring system to measure area deprivation, and this is called the Area Deprivation Index, and they measure it on a scale of 1 to 10. So for example, here in Ann Arbor, the ADI score is 1, so that means low deprivation. However, the ADI score in Northwest Detroit is 10, so that reflects the worst possible deprivation. And in Oscoda County in rural northern Michigan, the ADI score is 9. And so both rural and urban areas can be defined as deprived. So you might be wondering, how does area deprivation influence cancer risk? So let me give you one example. In a large study of men with prostate cancer, Patients who lived in deprived neighborhoods had worse cancer symptoms, worse quality life, and had an increased risk of dying from their cancer when compared with men who lived in better, less deprived areas. So this is another example of why where you live matters, and you may have no control over where you live. Next, let's talk about how food insecurity puts people at risk. People who have been subject to racial discrimination, lack a good education, and have low incomes often live in areas where there is limited access to healthy food. And this is defined as being more than 10 miles from a food store or a grocery store where one can find healthy foods like fresh fruits and vegetables. Food insecurity is also tied to the concentration of fast food chains in a geographic area. So while fast foods are less expensive, eating these types of foods every day is unhealthy and contributes to obesity. And we've already learned that this is important because obesity increases cancer risk. The same scenario applies to exercise. Research demonstrates that exercise decreases cancer risk. In a large study conducted by the National Institutes of Health and the American Cancer Society, the physical activity levels of 1.4 million people were studied over 11 years, and the researchers concluded that regular exercise may reduce the risk of developing up to 13 different cancer types. So if you live in a zip code where there's no place to walk outside, no parks, no usable sidewalks because you live on a busy street, you may be more likely to stay inside and exercise less, and this may put you at increased risk for cancer. And lastly, let's talk about how poor access to health care increases cancer risk. And again, I'm going to use an Alabama-based example, and this one will be about women's health. So earlier in my talk, I picked on the people in the balcony. Now I'm going to pick on the people in the back of the room. So all of you folks now, you live in the Alabama Black Belt. This is an area in mid-southern Alabama that was originally named after the richness of the black soil there. Cotton production brought a lot of wealth to that area, but over time, depleted soil and the boll weevil destroyed the cotton plants, and so the area fell into deep poverty. I visited the Black Belt a few months ago and witnessed this extreme poverty, and I learned later that 50% of the people there are black and make less than $13,000 a year. The area comprises 17 counties over 300 square miles, and there are only 8 general practice physicians that are working in that area, and there are only 4 counties that have a gynecologist. So the access to basic health care there for women is terrible. Also, women in the Black Belt lack access to basic health care, specifically cancer screening, because they are more likely to be uninsured. This is because Alabama politicians have not expanded Medicaid coverage for people who can't afford regular insurance. So women in the Black Belt can't afford to see a healthcare provider, even if there was one nearby. And so they do not get screened for cervical cancer or breast cancer. Compounding the problem is a history of research misconduct in the Deep South. You may have heard of the Tuskegee syphilis study that began in 1932. Black participants were allowed to suffer and die from syphilis, even when a cure became available. They were not offered the cure because the researchers wanted to see what would happen if the disease was left untreated. So as you can imagine, this fueled a long-standing distrust of the healthcare system, which remains today, that makes some African American people hesitant to seek out health care and also hesitant to participate in research studies. And I've definitely witnessed that in my own research. And so due to poverty, poor access to healthcare providers, lack of insurance, as well as a deep-rooted fear and mistrust that grew out of racism, the death rates from cervical cancer, which is a preventable disease, and breast cancer are higher in Alabama than they are in any other state in the United States. So to the women in the back of the room, do you have the same access to resources that can help to protect you against cancer as, let's say, again, people up in the balcony? So now let's quickly transition to health equity. Health equity takes away these barriers. Health equity is about having a just opportunity to an education so that you can make a decent living, live in a good place, exercise, have access to healthy food, and access to good health care. Okay, so now I'm going to transition to this part of the room. To our newly graduated BSN nurses, our nurse practitioners, nurse midwives, nurse leaders, nurse scientists. Because after all, this day is all about you. You did it. You've overcome so many challenges to get here today. And because you are brilliant, hardworking, and passionate about helping all people to stay healthy, let me present you with your next challenge. So every one of you, regardless of what degree you've earned, you can do something small or something large to address health inequity. Those of you who will be working in hospitals and clinics, you've learned through your coursework and clinical experiences that you shouldn't blame a patient for their illnesses, but instead, you should screen them for social factors. Ask them if they can afford their medicines. Teach them about the best foods to eat to stay healthy. And ask them if they need help to get routine cancer screening. Your patients will talk to you because they trust you. Use what you learn to guide care, educate, and provide referrals to resources. To our DNP prepared nurses, you'll use your new skills to find, evaluate, and implement the best research evidence into your clinical practice. And when you witness firsthand how laws and political decision-making have caused a certain population of people to be denied basic access to health care, and that lack of access is causing people to die, you are now equipped with the clinical expertise and power to do something about that. And to our PhD prepared nurse scientist, you know that there's an urgent need for more research about health inequity. And the good news is this is a hot topic and is very highly fundable. And so regardless of your area of scientific interest, I hope that you will create new knowledge that will uncover how and why health inequity may be compromising the health of all people, regardless of whether they have cancer or other pervasive health conditions like diabetes, obesity, heart disease, dementia, depression, and even infertility. Your discoveries will not only identify ways to help people across the globe, but your science will inform new laws, policies, and regulations that can stop pervasive systemic health inequity. So lastly, I'll end with a call of action to all of us. We all can do something to address health inequity. We can vote for political leaders who understand that addressing health inequity is critical to the health and well-being of all their constituents. Addressing health inequity must be a priority because our health is everything. Thank you. Go Blue.
Thank you, Dr. Smith. We are honored that you joined us here today. It's time to present our students who are earning their doctoral degrees. It's always a major milestone when any degree is awarded. The doctoral degree is the highest degree that can be awarded. Its achievement is truly a major accomplishment. Today, we recognize this achievement by hooding those who have been granted a doctoral degree. Hooding is a tradition that dates back to the Middle Ages. By awarding this hood today, we welcome our doctoral students into the community of nurse scientists and scholars. Congratulations. We will first hood our 2024 PhD candidates. PhD Committee Chair Dr. Olga Yakusheva will be hooding them along with Dr. Sarah Stoddard, who is the director of the PhD program. Associate Dean for Research and Rackham Graduate Studies, Dr. Crystal Patil, will announce the students' names, dissertation titles, and committee chairpersons.
Hannah Celeste Ratliff. Catherine Lee.
We will now begin hooding the Doctor of Nursing practice candidates. Each student's committee chair who mentored them throughout their education will be hooding today's graduates, along with Dr. Elizabeth Duffy, who is the director of the Doctor of Nursing practice program. Chief Health and Academic Equity Officer Dr. Rushika Patil will announce each graduate's name, scholarly project title, and committee chairperson.
Please note the project titles are in the program. Ashley LaRock. Dalton Bender. The following students are being hooded by Dr. Raymond Blush. Jessica Parker. Lisa Rydell. Dana McFerrin. Emily Swiderski. Kimberly Lynn Howard. Rachel Chaco. Eva Tabarani. The following graduates are being hooded by Dr. Mary Franklin. Stacy Bijamin. Kelly Creel. Taylor Bunyak Yusuf. Rebecca Rayberg. Michelle Hopkins. Amanda Hooker. The following graduates are being hooded by Dr. Laura Gultekin. Amanda Compton. Brittany Williams. Christina Saeed. Resmi Bashiam. Melissa Reffett. Emma Evans. Megan Carr. The following graduates are being hooded by Dr. Yasemin Kusunoki. Elena Cecile Dean. Rachel Lynn Ferrero. Alicia Giniak. Alexandria Garbus. Taylor Jane Flynn. Hannah Zoran. Cameron Burmeister Torchia. Allison McLean Schmidt. The following graduates are being hooded by Dr. Catherine Nelson. Madeline Catherine Green. Jessica Marie Filak. Amanda Cheedy. Jacqueline Pakulski. Alexandra Barrett. Kellyanne Gormley. Noor Ali Anani. Kurat Ulain Awan. The following graduates are being hooded by Dr. Michelle Pardee. Lila Khan. Alexa Mariana Miller. Alopi Atish Modi. Sophia Jane Poley. Elizabeth Habercorn. Gabrielle Troy. Dr. Sharia Robinson Lane will be hooding Maggie Yiping Zing Wang as chair. The following graduates are being hooded by Dr. Ruth Zielinski. Esther Baya Jung. Chelsea Schroeder Lozada. Brianna Renee Young. Fiin Foloa Morinikeji. Sophia Namazi.
It is now time to recognize our Master of Science in Nursing graduates. Associate Dean for Professional Graduate Studies, Dr. Lisa Kainlow, will be announcing students by program. I would like to invite the program leads to gather across the stage to congratulate your students as they process across the stage.
The first group of students is the Adult Gerontology Acute Care Nurse Practitioner Program students. Abigail Dutcher. Jessica Ann Holling. Caitlin Scrogans. Maruna Hanzu. David Tom Batsos. Patrick Stephen Bennett. Keith Anthony Dormus. Katie Hassong. Assad Loya. Xiaoshong Wani. Noah Salih Alfrani. Abra Khalid Garara. Zainab Habib Al-Hala. And now we're going to be transitioning to the Adult Gerontology Primary Care Nurse Practitioner Program. Karen Sheen. Karen Elizabeth Eicher. Perfect. Lindsay Bixler. And we have our one and only student in the combined midwifery primary care family nurse practitioner program, Hannah Lee Elschnick. We have the Leadership, Analytics, and Innovation Program students, Jennifer Schwartz. Melissa Borders. Brianna Lee Miller. Erica Spearman. Danielle N. Pataja. Sarah Lynn Bergdorf. Aaron Gallagher. Kelly Seihever. Samantha Smith. Chloe Shaylin Lark. Stephanie Cruz. Candice Duarte. Sarah Jane Harless. Donna L. Robinson. Ashley Lynn Sims. Sarah Michelle Kelly. Kelly Marie Proctor. Blythe Monetta Hare. And now we'll be transitioning to the nurse midwifery program. Brianne Marie Pengrazi. I got it. I practiced. Gretchen Hackenjos. Osha Humphrey. Miriam Shams. I'm going to say it right. Shu Yan Shu. And now we have our primary care family nurse practitioner program students. Alani Ann Thween. Followed by Amber Marie Thween. Deanna Rita Hakim. Jessica Ann Yaldu. Lauren Haydu. Marlena Rose McGarian. Courtney Lee Young. Jacqueline Elder. Heywan Koo. Meghna Hala. Savannah DeShano. Jennifer Nicole Keiss. Heather Rose Ferguson. Mariellen Herjar. Carla Mary Toma. Corey Tamika Johnson. Ani Trevanian. Heather Prusy Wilson. Katie Slusser. Aaron Rafferty. Abbas Ali Kang. Rachel Ann Twitchell. Alyssa Sabulka. Jenna Mulder. Catherine Bryce. Lindsay Cash. Sarah Fighton. Jasmine Alyssa Gordon. Kaylee Joy Selke. Now we have our primary care pediatric nurse practitioner program students. Jill Suzanne Sanabria. Shalina Janae Griffith. Emily Lauren Roberts. Amber Eileen Flannery. Shannon Elizabeth Nugent. Laura Don. Marissa Eileen Young. Allison Rose McGregor. Sharouk Omar Abul Al-Noor.
Now for the time you've all been waiting for. University of Michigan School of Nursing, Bachelor of Science in Nursing, Class of 2024. Please come forward to be recognized and receive your Michigan Nursing Pin. A nursing pin is a symbolic welcoming of newly graduated nurses into the nursing profession. Associate Dean for Undergraduate Studies, Dr. Dana Chanin, will be announcing our graduates' names. They will receive their pins from Dr. Karen Hardin and Dr. Linda DiClemente.
Carolina Alexandra Ballesteros. Nina Juliet Hidalgo Guzman. Christine Wynn. Amesade Falconer. Abigail Laura Elizabeth Rubin. Brooke Eileen Starr. Isabel Therese Scherer. Emma Pont. Madeline Rose Taylor. Abigail Grace Zornig Strayer. Montana Rose Kyle. Courtney Rose Dalton. Braden Madeline Hirsch. Kelsey Pearl McGuire. Megan Marie Sorenko. Caitlin Marie Saint Amour. Ryan Elizabeth Skirman. Emma Elizabeth Fordry. Colleen Elizabeth Verla. Madeline Paige Shahowski. Kate Tandon. Anna Claire Weaver. William Patrick McKinley. Madeline Bryn Poupard. Meredith Lee O'Brien. Catherine O'Keefe. Piper Miller. Alexandra Nicole Sinaldi. Carolyn M. Carolyn M. Tully. Ethan Thomas Nizak. Sophia M. Chieco. Grace Catherine Fadul. Lauren Miller. Marissa Angelique Kaur Baines. Ella Morgan Nasco Mackey. Madeline G. Snow. Haley Charlene Curry. Claudia Rose Bringle. Melissa Scully. Rhea Megan Van Plagenoff. Linnea Claire Brunvand. Ella Claire Gertis. Marissa O'Leary. Elena Beth Newton. Mackenzie Marilyn Kalishman. Priya Kaur. Teresa Louise Novi. Aubriana Danielle Thielen. Emma Ruth Van Dyke. Hannah Lynn Vanderskoff. Lauren Elizabeth Hewitt. Grace M. Van Beek. Tegan Alexis Long. Sarah Brittany Livin. Marissa R. Valade. Hannah Victoria Slauson. Anna Rose Naj. Amaya Brown. Sophie Isabel Harb. Caitlin Elizabeth Cole. Janelle Pua Mapili. Angela Maya Pumford. William J.W. Shu Wang. Alexander Regis Dunn. Andrew Michael Hanna. Amy Lee. Delaney Margaret Schreiber. Delaney Sarah Hatt. Olivia G. Hay Mahoris. Say it again. Gloria Deborah Ravori. Samantha Elizabeth Luke. Rachel Joy Coinga. Maddie Mazer. Emily Esther Cook. Om Vanch Patabi. Manuel Richard Fajardo. Morrison Samuel Schmidt. Anne Marie Madian. Abraham Alejandro Fernandez. Adam Mark Haydanik. Zoe Elizabeth Gainey. Ava Ray Chang Jenkins. Carly N. Davis. Eric Raymond Gaynor. Diana Goldansky. Jessica Louise Rayon. Rose Bricker. Grace Berry Foster. Hope Ambrose Himwan. Elise Sikora. Olivia Arguello. Naomi Vanderveld. Elsbieta Schott. Isabel Lorelei Weathersby. Sophia Abrams Rivera. Jenna Elise Dykstra. Emma Elizabeth Davidson. Janine Hassan Crayum. Grace Mary Fisher. Lillian Crook. Dora Chen. Nisha Brianne Thomas. Hannah Elizabeth Floyd. Alyssa Ann Berrigan. Charlotte Delaney. Jack Ryan Yates. Hamida Gali. Nicole Shauna Santoso. Jessie Sue. Mi Han Liu. Amy Shu. Michelle Tiffany Yang. Claire Ryan Cook. Megan Catherine Hoying. Sydney Eliza Jacobs. Taylor Catherine James. Jillian Mary Guerra. Jane Jakubik. Emily Marie Dow. Samantha Ellen DeMacy. Molly Caitlin Clifford. Bree Carlin Baker. Tabitha Stange. Janet Sayun Lee. Nafisa Dahir Ahmed. Fat Win. Jeremiah James Kenny. Dorothy Okafor. Abima Folua Blessed Anina Fade. Sierra Randall. Brooke Davis. Athena Isabel Salick. Lauren Nicole Brewer. Autumn Anne Marie Farnham. Elise Corinne Petchler. Kaya June Constantinidis. Rebecca Ann Kenlin. Avery Lee McQueen. Grace Anna Bars. Rose Elizabeth Henke. Haley Michelle Barnett. Natalie C. Wheeler. Olivia Simone Lockhart. Megan Nicole Wilding. Lauren Elizabeth O'Donnell. Erica Elizabeth Ware. Anna Wang. Litzy Garcia. Elise Bryce. Caroline Back. Lucy Yun. Jessica Sue. Angeline Lee. Kayla Alexis Hurley. Ariel Jackie Gregory. Maya Ann Wyckoff. Caitlin Ruth Claveria Henes. Mia Luistro Rodriguez. Michelle Angela Taralba. Amanda Marie Arzadon Southerby. Ashley Ann Gamala. Neil Parikh. Teresa Maureen Klein. Carly Josephine Kubiak. Courtney Renee West. Megan Elizabeth Cronin. Emma Rose Norman. Marion Isabella Mamakunian. Isabella Sedevine. Erica Shanice Jeffrey. Miracle Kiamaka Wakachu. Miriam Marlena Williams. Zion Mary Shalom Helms. Mia Simone Snowden. Kayla Annette Wilson. Betsy M. Pichardo.
I want you to know I'm now officially deaf. Fantastic, absolutely fantastic. Congratulations to every one of you. So at this time, I invite all of the graduates to stand if you are able. And now is the time to move your tassels from the right side to the left. Fabulous. Let me get you to take your seats. So on behalf of the faculty at the University of Michigan School of Nursing and on behalf of the Board of Regents of the University of Michigan, I congratulate each of you on your graduation. You are the leaders and best, and I guess I could say go blue, but we've said it so many times. Should we do it again? Go blue! I want to thank many, many people that helped us get together today under such wonderful celebratory conditions. I particularly would like to thank Dean Blake Jones and her student life group that has been with us and made a lot of contributions. I want to particularly thank parents and friends, because without you, partners, kids, I mean, you're the ones that really should be celebrating along with our graduates. So now it's time to party. Let's start as we welcome you to join us at the Michigan League for a reception. In the Michigan room, we've set up a photo area with a UM School of Nursing backdrop for those of you who want more photographs, and a professional photographer is there ready to capture photos of all of our students, particularly BSNs who might want to have a photograph of getting pinned. So please take advantage of that special opportunity if you would like. There's some additional photo backdrops that are available in the main ballroom for all students to take pictures with those friends and family that count so much. Thank you for all of you for joining us today. It means a great deal. I would ask that you would please remain seated until all of the students have left the auditorium. And we will close with Dr. Dana Chanin, who will lead us in the singing of the Victors.